This video is the first I'll be posting in a series of videos I'm doing as a follow-up from NTI in a presentation I do every year called Critical Care Studies You Should Know About. The focus of the presentation is to basically me do an evaluation of the last year of literature to kind of get an idea of what might change our clinical practice. This first study was focused on thiamine administration. So the research question was, does thiamine administration protect the kidneys and possibly reduce mortality in the setting of septic shock? For the past 2 decades, there have been a number of studies published really evaluating the role of thiamine in sepsis. The literature seems to be supporting the role of thiamine in mitochondrial resuscitation, providing some protection against organ injury, and then possibly reducing mortality. And as we all know, when patients develop kidney injury in the setting of sepsis, a lot of issues ensue. Patients have increased ICU length of stay, increased hospital length of stay, increased cost, and higher mortality. It's a major issue. This study was a post hoc analysis of 2 randomized control trials that evaluated the role of thiamine in septic shock. 158 patients were analyzed from the study, and they, again, were comparing thiamine versus placebo in septic shock. Renal protection was defined as survival without the need of renal replacement therapy. One of the things they did in these studies was they measured thiamine levels, and they defined a low thiamine level of less than 8, which is pretty darn low. And these patients who were in the treatment group that received thiamine got 200 milligrams every 12 hours for 3 days. So this is what we call forest plot that's often done in statistical analyses when they're comparing a treatment to placebo, looking at differences between the groups. And then in a meta-analysis, what they often will do is kind of look at multiple studies and see if there was an effect either to the treatment or placebo group. The first measure from this post hoc analysis was kind of looking at patients who were alive and renal replacement therapy free. And what you can see is there were way more patients alive and renal replacement therapy free in the thiamine group versus the placebo group, and it was statistically significant. Now, where they saw the biggest difference was in patients who were actually thiamine deficient. And so the top graph looked at everybody regardless of their thiamine level. And then here you could see they're specifically looking at patients who are thiamine deficient. And what you can see is a massive difference in the thiamine deficient group being alive and renal replacement therapy free if they received thiamine, which is just a crazy thing to think about because it's so inexpensive and it's really easy to do to give thiamine. So the question we're asking now is should we just consider assessing thiamine levels in patients who have septic shock? Or I will tell you, some experts are saying, forget, just give them thiamine. What's the big deal? I don't know. I have some interesting perspective on this. We were looking for a while, evaluating the whole metabolic resuscitation where we did vitamin C with thiamine and steroid, and and there were some very mixed results on it. But one of my thoughts is the reason we didn't see in some of these bigger randomized control trials differences when patients were given the vitamin C, thiamine, and steroid. One of my thoughts is they were given too late. Really, if you want to see an effect, what a lot of these studies are doing, at least the early studies, is they're giving the drugs in the emergency department when the patients present in septic shock, not a day and a half later when they're in the ICU in overt shock. And so I think that's the key to anything is you want to look at timing. So I think really, really interesting. Thiamine, again, it's super affordable. Thiamine levels might be kind of challenging because your lab may not have the ability to do them, but I think it's honestly an interesting thing to think about. And I'm going to be watching the literature to see where this goes.